Welcome to the case-based medical microbiology video series, and we are on case number 13. So, without wasting time, let's dive into it. An adolescent presents with brownish urine that has been present since the previous day. He had a sore throat 2 weeks prior that has gone away. A physical examination reveals high blood pressure and puffiness around his eyes. Serum tests are significant for high blood urea, nitrogen, and creatinine, as well as positive ASO, that is anti-septal eosinophil test, and decreased complement 3 levels. Furthermore, urine analysis reveals the presence of protein as well as RBC cast, although no kidney biopsy was taken. Electron microscopic investigation would most certainly to detect subepithelial humps in glomerulus. So too many clues has been given, and it is very obvious that this condition is, any guesses? So yes, you've guessed it right. It is post-streptococcal glomerulonephritis, or PSGN, caused by Streptococcus pyogen as non-suppurative immune-mediated complication. So it is a glomerulonephritis as indicated by hematuria, that is brownish urine. It has a sore throat 2 weeks prior ago that is indicative that streptococcal infection could have happened, and all the features of renal involvement is there. That is puffiness around eyes, high blood urine nitrogen, creatinine high, and positive ASO test again indicative towards streptococcus pyogen infection. The C3 level is low, that indicates that complement mediated mechanism is involved, that is mostly type 3 hypersensitivity, and urine shows RBCs as well as protein. So proteinuria, hematuria is there, and this subepithelial hump in glomerulus stamps the diagnosis. So let us further see what is the pathogenesis, what are the investigations, and what is the treatment. Let us see it in detail. So first, the pathogenesis. So streptococcal pyogen skin infection or pharyngitis. Here it is pharyngitis, but even skin infection can lead to this condition. So obviously, our immune system will form anti-streptococcal antibody, and this antibody will combine with streptococcal antigen and form immune complexes. These immune complexes, they go and deposit on glomerular basement membrane. So this is basically immune complex mediated type 3 hypersensitivity. And what happens in that basically complement they attach to this antibody, which is already attached to the antigen, which is attached to the cells of human tissue, and that causes inflammation and damage. So 2 to 3 weeks after infection, patient developed nephritic syndrome, mainly characterized by hematuria, hypertension, periorbital edema, which is evident in this case. And mostly type 3 hypersensitivity, they spontaneously recover. In many cases, 85 to 90% cases, the spontaneous recovery is seen. So which investigation we will do? So many investigation has already been done in this case, like blood urea nitrogen and creatinine to check for renal function test, urine analysis to check for proteinuria, hematuria, and RBC cast, complement 3 level, which is low, which is indicative of type 3 hypersensitivity, ASO test as evidence of past streptococcal or any time streptococcal infection, which is usually positive, and to stamp the diagnosis of PSGN, you need kidney biopsy, mainly electron microscopy finding, that is subepithelial humps, that is lumpy, bumpy pattern, are usually not required. Above tests are sufficient to clinically stamp it as post-streptococcal glomerulonephritis. Now, which treatment you should do? Usually it is a self-limited condition, so complete recovery happens, as I already earlier told you, that 85 to 95% cases they resolve spontaneously. So nothing much is required. Just give supportive and symptomatic treatment. That is sufficient for you to do in this case. So I hope you have learned something about this case which is relevant to your clinical practice. And if you like it, do share it with your friends. Do subscribe to the channel, and what more? Wait for the new video notification. Thanks.